Hi, and thank you so much for popping by. My name is Bita Pobalozi. Feel free to call me Bui. The reasons that I'm talking about the HIV travel restrictions is because I was watching one of my favorite YouTubers, Nozi Kamngana Mayaba. She's called Nozi. So according to this report, mandatory HIV testing, mandatory or forced, right? HIV testing and bans on entry, stay, and residence based on HIV status not only do not protect public health, but undermine HIV prevention and treatment efforts. For millions of people living with HIV around the world, these are repeated violations on their right to privacy, equality, and non-discrimination, and a constant reminder of HIV-related stigma. So the key message from this report is that restrictions, these travel restrictions on entry, stay, and residence based on HIV status are discriminatory and cannot be justified on public health grounds. Everyone should have equal freedom of movement regardless of their HIV status. Number two, there is no evidence that HIV-related travel restrictions protect public health. In fact, they are likely to impede efforts to protect public health by creating barriers to access to services for people living with HIV and people at higher risk of HIV. Number three, travel restrictions based on HIV status fuel stigma against people living with, at risk of, and affected by HIV. They can create a misleading public impression that HIV is a foreign problem and therefore interfere with the efficacy of public health messages on the prevention of HIV. Number four, travel restrictions related to HIV status may impair access to antiretroviral therapy, especially in countries and areas where access to treatment, care, and support programs and services is limited. Five, there is no evidence that people living with HIV will engage in riskier behaviors than people who are not living with HIV. Number six, most countries in the world do not have or have lifted their HIV travel restrictions on entry, stay, and residence. Those that have lifted HIV-related restrictions have found no need to readopt such measures. All right, so number seven says, UNAIDS opposes mandatory HIV testing and restrictions that limit or restrict movement based on an HIV positive status. There is no scientific or public health evidence to support people living with HIV and people living with other health conditions such as chronic heart or liver diseases, diabetes, or cancer being treated differently. So typically, HIV-related travel restrictions usually involve a mandatory declaration of HIV status and/or testing, which is often conducted without appropriate counseling, confidentiality, or referral to HIV prevention, treatment, care, or support services. A denial of or waiver for entry based on HIV status is usually noted in immigration and/or visa records. In addition, non-nationals who are found to be living with HIV during testing undertaken for the renewal of their study, work, or residence permits may be confined in immigration detention centers where they often do not receive HIV-related care before being deported. And HIV-related travel restrictions undermine human rights, and freedoms of people enshrined in international treaties and national constitutions, such as freedom of movement and choice of residence, access to and enjoyment of life opportunities, and the ability to be united with families and to participate in social and public life. Alrighty, my friend. Thank you so much for popping by. I hope you're having a lovely day where you are. But most importantly, I hope you're having a healthy day wherever you're watching me from. Bye.